I'm Terry Aranga with my guest, Brian King, and today we'll talk about being yourself and socially effective. Brian King is a licensed clinical social worker in private practice in Naperville, Illinois. He brings a unique threefold perspective to the world of Asperger's. Brian is the father of 3 sons on the Autism Spectrum, has a practice focusing exclusively on working with Asperger's clients and their families, and is also an Aspie himself. Brian is a popular author and conference presenter who has become known worldwide for his positive approach to living the Asperger's experience. Brian, thanks for joining us.
Thank you, Terry. I really appreciate it.
Well, first of all, I guess we better define what Asperger's is.
Well, I guess it really depends on who you ask. You have the traditional medical model, which, of course, defines Asperger's as on the higher end of the autism spectrum and refers to it as a syndrome. And its polar opposite on the autism spectrum is autistic disorder. And that label alone has a lot of implications for the people that are on the receiving end of that label. My clients in particular resist it because of the very notion that it means they're broken. The way I like to define it is that it's a specialized way of thinking that pretty much renders someone specialized in one area, but then having challenges in another, specifically in the area of social interaction. So I know it's kind of a lengthy response to your question, but the way you define it has a lot to do with how you define the problems it causes and then what solutions you seek in order to address those problems.
Right, that's a very good point. Sometimes people look at individuals with Asperger's syndrome and they might also use the term high-functioning autism, but is that true?
Well, honestly, in terms of clinically speaking, there are no criteria for high-functioning autism. That's just some clinical jargon that's kind of worked its way into the mainstream. But in terms of what is Asperger's, what is high-functioning, it's really a judgment call. There can be a lot of overlap. My understanding from the people that I've talked to who use that term, high-functioning autism begins by looking backwards. You look at the person when they were younger, and if there was a speech delay, which pretty much puts them more in the autism category clinically than the Asperger's category, then you look at them now and say, well, because they began more autistic and they've gained more verbal ability now and they look more Asperger's because they began autistic, we're going to call it high-functioning autism. That's my understanding of how clinicians tend to differentiate between the two.
All right. Now, I wasn't originally going to bring this up, but you mentioned something about individuals, you alluded to individuals resenting somebody thinking they needed to be, like repaired, fixed or something.
Mm-hmm.
And I know that there's been some discussion in the community where some individuals will say, we don't want to be fixed, and then there are other individuals who have physiological problems that prevent them from being healthy and functioning well and safely and independently. Children who are ill, for example, who have full syndrome autism. How do you feel about the two sides of that question?
Well, my biggest concern is that people are speaking, they need to be speaking from their own perspective, but they're also feeling compelled to speak for the other side. Myself, for instance, I have some intestinal issues, but I don't have the same intensity of those issues that make it difficult for me to eat even the simplest of foods. So I feel in no way that I am competent enough to speak for that group. So when there are other people in my end of the spectrum who feel confident enough to speak for people with greater challenges, I wish they wouldn't, because it really complicates the dialogue. It's the same concern I have when neurotypical parents would say, I know what's best for my child and I know what my child needs, when they haven't consulted the child. And in my case, I'm talking about children that can speak for themselves, as opposed to the more nonverbal, more challenged kind. But when somebody is in physical pain, I consider that tantamount to somebody who has psychological pain, like a depression or something, and by virtue of that pain, it really limits the options they have for their life.
Mm-hmm.
So that limitation, it's important to address it in a way that it increases a person's options. I, by no means, by virtue of my challenge, the various challenges that I continue to have in terms of executive functioning, organization, I don't want to be so married to those things that I say, no, I feel a right to be, limited in this way. That logic doesn't follow. So if there is a child that has a physical challenge, by all means, if that can be addressed, address it. But I think the concern that comes from people on the higher end of the spectrum that I've talked about, the concern is that it won't stop there. That in addressing the physical challenge, you also want to go after the psychological eccentricities or nuances that are actually beneficial. So I think there's a concern on the Asperger's side of things that the parents who want to address the more physical aspects of autism are taking an all-or-nothing approach to it. Let's get rid of all of it. And I think that's where a lot of that concern comes from. I don't see it that way because I've had a lot of challenges in my past with anxiety, with depression, and all kinds of challenges, and I feel I can address those things independently without having to eradicate the good parts of who I am. So I think if autism in its classic sense is addressed in that manner, then I think we're very much on the same page.
Mm-hmm. Now, you've mentioned anxiety. Is there a higher degree of anxiety, do you think, among individuals with Asperger's?
Well, it seems, again, I can really only speak from my own experience.
Okay.
I don't want to make any generalized comments.
Sure.
But in speaking from my own experience, my children, my clients, and the others that I've come across, it seems to be a constant. It's part of the baseline of our experience. And the reason anxiety is present is because we have this overall difficulty with problem solving in the moment. And this anxiety is anticipation of, oh my goodness, when is the next problem coming along that I don't know how to solve?
Mm.
And that challenge comes with the mental effort that it takes to think in an organized fashion, because problem solving is all about thinking in an organized way. And I watch my 7-year-old try to make his lunch in the morning, and as much as he can do it, what I was able to get from him the other day is it's hard to get everything together. I mean, yeah, you know where the bread is? It's in the same place. The peanut butter's in the same place. But for his mind to just say, okay, I need to think and focus right now on the things I need to bring together to make this happen. Then he has the fine motor challenges of manipulating the knife, to cut the crust off, to spread everything on there. And for him, that is mentally exhausting. So he dreads the idea of making a sandwich. For somebody else who doesn't have those challenges, to say, oh, he's just being lazy, he just doesn't want to do it. But when you talk to him and watch him, this is a mental effort like anybody else might not appreciate. So imagine going through life, having to make the deliberate choice to focus on something and then organize your brain to solve that problem. Now imagine your entire life is about solving problems, which is what all of us do. We solve the problem, what clothes am I going to wear today? What am I going to have for breakfast? And there is a systematic process that happens automatically in the neurotypical brain that people on the spectrum have a challenge with. And so there's always an underlying anxiety of, oh, my goodness, what's coming next?
Wow. When you look at it that way, then you really feel compassion for the person.
Yeah, that's my everyday experience. I mean, people hear me speak very eloquently, and I've developed that ability over time, but I focus with absolute intensity on choosing my words precisely. And after a day of working with clients, I go home mentally spent because of having run that mental marathon through the course of a day. But yeah, the other spectrumites that I talk to, once I reveal this insight to them and say, is this true for you? Is this what it seems to take in order for you to solve these problems of the day? They throw their arms up and say, yes, can you please explain it to my friends? Can you please explain that to my parents? Because by virtue of my my verbal abilities, I'm able to articulate my own experience and kind of help others translate it throughout their lives.
Well, it's really cool that you are able to share this insight to help others, that you're someone coming from the same perspective rather than, quote unquote, an outsider trying to make judgments for someone else, but who can't really feel it.
Right.
Yeah, that's very cool.
And that insight exists within the spectrum. I mean, even though I have this experience of having Asperger's or whatnot, I make a point of not taking for granted that every aspect of my experience here is the next aspect.
All right. Before the break, Brian, you had been explaining that a lot of the anxiety that individuals with Asperger's may be feeling has to do with problem solving, and problem solving to a magnitude much greater than the lay person would imagine, where even making a sandwich becomes sounded like a major project. I would have thought that much anxiety also came from social skills issues, feelings of isolation. Am I on the right track with that?
Well, a lot of it's important to look at anxiety in the context in which it occurs, because a lot of the anxiety at home versus anxiety in school versus in a public place, it could be a sensory issue. You know, the overall irritation of the system of being overloaded with all this input that you can't sort out. In a social situation, it could be the anxiety of being afraid of looking bad because you don't know what to do. So in that case, it's anticipation anxiety, the anticipation of if I say the wrong thing, if I do the wrong thing, I'm going to look bad in front of somebody else. So it's important to understand it in the context.
All right. So how do we work through these issues?
The first thing to work through it, and again, it's crucial that the individual on the spectrum be involved in this, because it's first and foremost, it's acknowledging what the problem is. And in the context, if it's another person, if you just have this feeling of overwhelming anxiety but you don't know where it's coming from, then how on earth can you go about managing it, decreasing it, and dealing with it in that moment? Once you identify the problem is in the social situation, I'm afraid of looking bad. Okay, once you've identified that problem, what do you need to do to address the fear of looking bad? Can you teach certain skills that would make that less likely to occur? If so, then a person goes into that situation with a greater sense of competence. They have more tools to address that fear, so no longer is it a concern because you have those tools. If the anxiety is caused by being in a grocery store because of a sensory issue, and you know it's because there's too much sensory input coming in, then you can say, all right, having defined that problem, what senses are being overloaded here in the store? And what resources do I have at my disposal in order to deal with that?
Let's talk about a concrete example. If you have a teenager, perhaps, and he's trying to join in laughing with people, but is laughing at what they would perceive as inappropriate times or in an inappropriate manner, how do you encourage that person to be themselves but still fit into that social situation so that they feel better about the experience?
Well, something else needs to happen first, and he needs to know, as I say, he or she, or I guess it really doesn't matter for the purpose of the conversation, but what tends to be the breakdown in that moment is a person on the spectrum wants to join in and feel included in that, but they have no concept of what they want to contribute. That's why they just kind of jump in randomly. Okay, everybody else is laughing, so I'll just laugh. I don't know when to laugh, but everybody else is laughing, so I'll just do it randomly. They're very hit or miss in their approach. So one of the main solutions there is to determine, what do I want to contribute? Because then once they've determined that, then you can be very targeted in what manner you're going to do so. Let's say you don't know anything about the topic that's being discussed, but you want to be part of the conversation. Perhaps your contribution is simply listening. Or perhaps your contribution is asking a very direct question, such as, hey guys, what are we talking about here? Those very simple ways of connecting that, again, begin with knowing what you want to contribute. Because simply wanting to be a part of something isn't enough. It's too vague. You need to know in what way you want to be a part. So I guess it always boils down to, first, defining what does it mean to connect with this group. And once you know what that is, then you can have very specific connection skills.
All right. What if your interests are limited and you want to be around people, but your interests are limited and aren't necessarily things that they're interested in? How can you be yourself and still be with the other people?
Well, what I've found about the whole limited interest thing is, and again, and the people that I've talked to and in reflecting upon my own experience, because of the fear of looking bad is so great, you will always default to areas where you know you are competent, and you are very unlikely to look bad because you're the resident expert. And as soon as someone starts talking about something you can't relate to, you're afraid of looking bad, so you want to pull it right back to where you're competent. So in order to encourage people to start thinking about discussing other topics, you first need to address that need to feel competent, that need to look good in front of other people. Once you realize that it is possible to look good by being teachable, to look good by supporting somebody else in their interests, then you can begin being open to the idea of not knowing something. But it first comes down to understand that basic fact. I don't want to look bad, so if I stay the expert and I'm always the center of attention, I'll look good all the time. So it's always beginning more simple than that. You know, one of the things that is really missed in a lot of the social skills trainings is they jump light years ahead of where the person's at. So we need to teach them, you know, conversation openings. We need to teach them social skills and chit-chat and all that when they haven't hit the basics of what is this individual trying to accomplish and what's preventing them from accomplishing it. You know, it's that fear of looking bad, that fear of not being competent in front of your peers. Because, I mean, I don't know how long it's been since you've been a teenager. You know, I'm turning 40 this year. But I remember just how unforgiving the social environment can be when you don't do it perfectly. And when you imagine that you're somebody on the spectrum who, as a matter of routine, does things a bit outside the box in a very eccentric manner and in such an unconventional way that when others see it, they're like, what are you doing that for? That's weird. I mean, it's not the least bit supportive. Mm-hmm. They don't come up and say, oh, it looks like you're trying to accomplish something. Let me try and figure out and help you make this connection here. Peers don't do that. They jump on you. They criticize you. Mm-hmm. So that only intensifies a person's feeling of, as you said earlier, isolation or disconnect. The more you make an effort and the more you're rejected by your peer group, the more isolated you feel. And in some respects, that can intensify your desperation to be included. Mm-hmm. So you'll come on stronger, you'll come on with greater intensity, but with still the same deficit in skills that you had before. So your own effort, your own motivation can actually make your differences even more obvious.
Mm-hmm. So what's the most important social skill that parents can try to help move their child forward with?
In my estimation, it's clarification.
Okay.
Because when you have a child on the spectrum that misses the subtle nuances of the nonverbal, assume that you're not getting all the information correctly. I mean, even when I talk to neurotypicals, nonverbal is unreliable. I mean, we have something called the poker face, you know, where somebody can choose their facial expressions. They can pretend to be happy when they're not. You know, people can choose and alter their vocal tone. I mean, when you go to learn how to be a professional speaker, they teach you how to manipulate your face and your body posture and everything to communicate a certain message that you want to communicate. So people can actually decide to be incongruent. They can be deceptive. So it's really important to realize nonverbal is unreliable. Also, when you have somebody on the spectrum that tends to be a unitasker, they're more visual or more auditory or more tactile. You see this a lot in the classroom. If a teacher is more likely to lean towards the visual, but you have an auditory student, well, and they say to the teacher, well, I need some help, and the teacher says, let me show you, when what the teacher needs is to have it explained, the student needs to know to ask for clarification auditorily. Like, excuse me, Mr. or Ms. So-and-so, it would be very helpful if you would tell me what it is you want me to know. Can you clarify for me what you want me to learn through my ears? Because seeing it isn't going to work for me. Or more tactile like my 7-year-old? Can I get my hands in it? Can I work with it and figure it out that way? But the clarification is all about asking for the information you need in a more concrete way.